doctors who are employed by Lagos State, government in their healthcare system, presently can at least boast of better income than their counterparts in other states. So government can do something like that. There are people who are willing to stay, even with the best offers coming from abroad. They feel better off in Nigeria.
Welcome to Healthcare Today. On this program, we give you all the health happenings around Nigeria. I am Aisha Sadona, and today we'll be talking about the Japa syndrome on the medical service providers. And we're happy to have our one and able executive producer in the building. You're welcome on the show, sir.
Thank you, Aisha. Thank you for having me.
Yeah.
So I'm Dr. Benson Ayodele Cole. This morning, like Aisha said, it's a case that bothers us in the medical profession. In the healthcare industry, actually, Nigeria, that we're losing a lot of professionals to foreign nations. So I'm happy to speak to you. Thank you.
Thank you, sir. So what are your thoughts on doctors leaving Nigeria to practice medicine overseas, and how do you believe it impacts both the individual and healthcare system involved, sir?
Well, the truth of it is the exodus of medical practitioners, doctors, nurses, radiographers, everybody involved in that value chain. It's not just to overseas now. Nigerian doctors and practitioners are leaving Nigeria for Ghana, they are leaving Nigeria for other West African countries, they are leaving Nigeria for other African countries, apart from Europe and America and every other place. So it's something that bothers us in the industry because it's impacting our healthcare industry very significantly. Of course, creating shortages in human capital in the industry, such that professionals that were widely available at some point, at least to work even in the cities, are no longer that available. You have to search, widely before you get people to employ, and so it impacts very significantly on our healthcare system. The rural areas, obviously, nobody wants to even speak about that now because we don't have enough professionals and practitioners to work in the cities, talk less of the rural communities. So it's a challenge. The Ministry of Health released a figure last week that says 16,000 Nigerian doctors left in 2023 or thereabouts, to other nations. That's a significant number. That's a significant number. And don't forget that these individuals are living with experience. They're going away with the experience they have acquired from the industry. So even if you're talking about replacing them, you can't replace that experience very easily. You understand? So it's a problem. Now for us as a nation, it impacts on our health security, and the health of our people. Before now, our healthcare indices and outcomes were not too good, even when our circumstances were better in terms of the number of healthcare practitioners available. Now the numbers are depleting. It will certainly, in a short time, begin to impact on the healthcare outcomes in the nation.
In your opinion, sir, what factor might have driven these doctors to pursue their goals abroad?
Two factors. Before now, doctors mostly and senior professionals in the field used to want to go abroad usually for training, for human capital development, to enhance their skills and all of that. But gradually it just became more of economic migration. The doctor is not able to pay his or her bills locally. And when I talk about the doctor, is one of the most senior persons in that whole service provider value chain, that whole ecosystem. So if the doctor cannot pay his or her bills as a senior person in the medical team, the same will affect the nurses, the same will affect the radiographers, the same will affect other caregivers, the physiotherapists, the pharmacists, So because of economic challenges, people want to travel out of Nigeria to go earn better income elsewhere, to pay their bills, to meet up with, just running their lives, paying school fees for their children, and taking care of their dependents. That's why most people are traveling out, as it is.
In this pandemic, has BCA done any project to help people?
Well, BCA has, as a company, we are trying to see what can we do differently. If you talk about the rural communities, like I mentioned earlier, they are completely underserved, and therefore the health challenges they face becomes more grievous, because if you are not able to treat diseases at the primary healthcare center level, at the primary stage of the disease life cycle, is likely to progress into secondary and tertiary complications that will require tertiary care and all of that. So what we have done as a company is to find a way to we designed a program that should be able to cater for the people in the rural communities, right in the community where they live, in terms of bringing primary healthcare services to them. That way we are able to catch diseases early, treat those conditions early, and prevent them from getting into secondary and tertiary care. So in that model, we are presently operating what is called the clinic in a bag, where you don't need to have a physical building to run a primary healthcare center, but the clinic in a bag has all the tools and implements that you require to attend to a patient, make a diagnosis, make a prescription, do very quick rapid tests, for common illnesses, and then be able to attend to that patient at that primary care level. All right, and this does not require even the participation of a doctor in the first instance. All right, because we don't have all the doctors to go around the primary healthcare centers we have in Nigeria, for instance. So we use the clinic in a bag, deploy community health extension workers. We utilize nurses, retired and still serving nurses in their localities. We use people from other medical professions, like medical physiologists. We use lab scientists in that whole combination to render care at this primary care level. And so it becomes only things that require secondary and tertiary care that are referred out of the community to maybe the nearest general hospital for those individuals to receive care. So this is how we are participating in trying to at least continue to provide services, while other means of replacing the doctors and the nurses and everybody that is traveling out can be devised by government, so that as people are living, we can literally produce more hands that will take care of our population.
That's a very nice one.
Thank you.
So lastly, what can Nigerian government do about the brain drain and how can they improve healthcare and retain their health practitioners?
Well, government is operating a lean pause, as you know. We're facing economic challenges as a nation. Doctors are not the only ones facing the economic challenges. Nurses are not the only ones. Everybody is in that whole milieu. But what Lagos State government has done, for instance, is that very quickly they have designed a new wage remuneration package, compensation package for their healthcare practitioners. And this is, as at last week, 2 weeks ago, they came up with this package, so that doctors who are employed by Lagos State, government in their healthcare system, presently can at least boast of better income than their counterparts in other states. So government can do something like that. There are people who are willing to stay even with the best offers coming from abroad. They feel better off in Nigeria. So government can look at improving the compensation, the remuneration, of doctors and nurses, radiographers and pharmacists and all those people in the value chain of healthcare service delivery, to retain them rather than losing these individuals even to our West African neighbors. Okay, so that is one thing that can be done. The other thing that government can do is to find innovative ways of increasing the population of medical graduates, that pass out of our institutions every year. Now, I know that universities have maximum capacity they can contain, or they can manage, in terms of training facilities and the likes. Therefore, why don't we look at other ways of making the universities to work with private sector operators? There are big private hospitals in Nigeria that can pretty much become training centers where doctors and nurses and the paramedics can be produced. I mean that because they not only do they have the capacity in terms of size and scale, there can be such innovation like having a hybrid system. A hybrid system, by which I mean the universities are handling the the theoretical part of things, the academic part of the academic structure, and then the private sector operators who are well equipped, who are well funded as well, are able to then render the training on the side of clinical training to these doctors. A country like Cuba has utilized that. Being an isolated country, they've been able to utilize their big private hospitals, as training centers to graduate doctors and to graduate people. And today, Cuba exports doctors to other countries, including to Nigeria. So that's something that can be done. And by doing that, you can simply use that model to increase the number of medical graduates that are being, produced in the country every year. And these people are even better equipped to go into the workforce, because training them with the private sector background, from a private sector background, enhances them even from day one to be ready for the market, if you understand what I mean. So it's a model that can be polished and then implemented. PPP, that's private-public partnership. The government is the public side of things, and the private hospitals are always there. They are already well equipped. Like I said, some are operating as much as 100 beds, some are operating as much as 50-bed hospitals, diagnostic centers, well equipped. May I even tell you that some of these hospitals are better equipped than the teaching hospitals that we have today in Nigeria. Some of the hospitals that are privately owned and privately operated are well equipped, better equipped than our average teaching hospital. So why can't those centers in the private sector be utilized in collaboration with government facilities to train doctors, to train nurses, to train radiographers, to train physiotherapists, to train all these people to train pharmacists, to train people in that healthcare value chain. And by so doing, you are not depending only on the universities available to produce your healthcare workforce. I think that's a model we can look at.
Thank you so much, Doctor, for your time.
Thank you.
It's been an amazing episode with our able producer. Thank you so much for watching Healthcare Today. Join us same time next week for a more interesting episode. Until next time, it's bye from me.